Today on Adversity to Strength, I'm joined by Julie McCammon, an intuitive, creative healing guide with more than 30 years of experience in physiotherapy and extensive training in myofascial release therapy. Julie brings a unique approach to healing that blends bodywork, coaching, and psycho-spiritual understanding of the three principles. Her work is based on a powerful idea that our bodies whisper to us long before they start to scream. Whether through chronic pain, fear, anxiety, or emotional overwhelm, Julie helps people learn to interpret these signals as guidance rather than threats, as messages pointing us back to alignment, clarity, inner wisdom. In this conversation, Julie shares her journey, her perspective of her mind-body connection, and the transformative ways we can learn to listen to ourselves more deeply. She brings compassion, insight, a grounded sense of hope, anyone navigating stress, pain, and feeling of being off track. Julie, thank you so much for coming onto the podcast today. It's great to finally get to talk with you.
Thank you.
Absolute pleasure. Tell me where your journey started with everything.
Oh, it probably started probably about 25 years ago. I was working as a physiotherapist, had two young kids, and I always loved traveling. And I was offered the opportunity to go to Nepal, to the foothills of the Himalayas, to do some physiotherapy training with the nursing staff because they didn't have any physiotherapy available and it was a very remote hospital. So I headed off there. We had good friends that were working there as a doctor and a nurse from Northern Ireland, where I'm from. And I was staying in their home while I was doing this training. And one night I suddenly took a really, really severe headache and it just came on totally out of the blue, had been feeling absolutely fine. And then I don't really remember the next sort of 3 or 4 days. I was nursed in my friend's home because the hospital was very, very basic and probably not the most hygienic. So they looked after me in their home, and the doctor, David, a friend of mine, worked out that it was probably viral meningitis. Now, we were up in a very remote area and there was no roads, so they couldn't get me out of that area. The only options were to be carried between two porters in a hammock or to get a medical evacuation by helicopter. So I really, at that stage, I couldn't even lift my head off the bed without being violently sick. And I just thought to sit in a hammock for 6 hours would probably be the end of me.
Yeah.
Through my medical insurance, thank goodness, they got a helicopter to land to medically evacuate me down into Kathmandu. And I'll never forget that. Like we put toilet roll out in the shape of an H on this like plateau and these rice plateaus for the helicopter to land, and it landed. And David had agreed to come with me because he was a doctor. So we got into the helicopter, and he was so excited to see the surrounding area he'd been working in for so many years.
Yeah.
And the two young guys like driving the helicopter looked about 14 years old. They were two Nepali guys. And one was sitting with the instruction manual on his knee, talking to the other guy. And I just thought, I'm never going to see my kids or my husband again. But long story, I went down into Kathmandu, got a lumbar puncture and flew home. Then after I was able to get the diagnosis, which was viral meningitis, the flight home was horrendous because I'd had a lumbar puncture. I probably shouldn't have flown straight home. But when you're so sick and so far away from your family, I just wanted home. Got to London, collapsed there, and my husband flew over to London to meet me, and they took me by ambulance to a local hospital. I can't remember whether it was Gatwick or wherever. And they wanted to do another lumbar puncture because they wouldn't trust the results of a third world country.
Right.
And I said to my husband, under no circumstances give them permission to do another lumbar puncture. I can't go through that again.
Yeah.
Got painkillers, got home. But that was the start of a very long road to recovery because I basically developed like post-viral fatigue, chronic fatigue, fibromyalgia, symptoms over about a 15-year period.
Yeah.
Just struggled very up and down. I wouldn't say I was totally debilitated for those whole 15 years, but it was a constant struggle of trying to find a balance. And every time I pushed myself a little bit over the line, I would end up just absolutely fatigued, aches and pains, brain fog, and the fatigue were just horrendous. So at this stage, I was running a busy physiotherapy clinic. I had other staff employed, and I loved my work. I had worked really hard to get where I was. It didn't come naturally to me academically. I was always told at school that I was dyslexic and illiterate and would amount to nothing by my English teacher. But yeah, so I had worked really hard to get my physiotherapy degree and to get where I was in my career. And I didn't want to give it up. I was stubborn. I was ignoring my body, not listening to the signs and symptoms. And I got to the point where I thought I was going to have to stop work because I just had nothing left after a day at work. And I'd heard about myofascial release. It wasn't a traditional physiotherapy technique at that stage. This is about 10 years ago. I'd heard about it and I'd heard that it was very gentle for the therapist to deliver. So I thought, okay, I'll go and learn that so that I can keep working, not thinking that it would have any impact on me personally. So I went off to America. I'm a great believer in finding the real source of a technique. So I discovered a John F. Barnes, who is a physiotherapist in America, and he's been teaching myofascial release for over 50 years. And he's sort of the grandfather of myofascial release. So I went off to Cincinnati and did 3 courses back to back because I thought I'm traveling so far, I'll try and pack as much in as possible. And obviously during that training, you're practicing a lot on each other. You know, there was maybe 100 therapists in the room, and John would demonstrate a technique from the stage, and then you would pair up and you would practice it on each other as he talked you through it. So that was a crazy journey. It was very different for me because I had been a very traditional physiotherapist, very linear, very scientific, very technique orientated. And this was something totally different. It was really, really deepening the whole mind body connection. And there was lots of people having like emotional releases. And I thought, oh, this is just really American and people are being really loud. And I held myself back. I wasn't going to go there. I was keeping control of myself. And then there was one technique that one of the other therapists was practicing on my head, and one of the tutors came around and was just standing there. He wasn't touching me or anything. And I just felt this overwhelming wave of emotion coming up.
Yeah.
And I started to cry like silent tears. And the therapist put his hand on the top of my stomach, sort of around your solar plexus area. And he leant down and he said, Julie, give it a voice. And it's hard to explain
Yeah.
the noise that came out of me. I was lying on the treatment table thinking, is this me making that noise? You know, it felt like almost an out of body experience. But that was just one little example of trusting the wisdom of your body and feeling that something wanted to release and just going with it and not resisting. And after those 3 weeks of training, when I came home, I had no symptoms.
No symptoms.
Yeah. And I'd been struggling with those symptoms for 15 years.
I mean, there's the book that you would know, the body keeps the
Yeah.
score.
Mm.
Obviously, I love that book. I recommend it constantly. I always go on about listen to what your body's telling you there as well. To be able to do what you've done, to get that, it doesn't surprise me, but it's amazing that you've got those results there as well. You probably find this with so many people that you deal with, that so many people ignore everything when it comes to the body.
Yeah,
It,
absolutely.
the body talks to you, so it is important. And I
Mhm.
think that would have been life changing for you physically and mentally.
Yeah.
How did you feel when you realized, hold on a minute, I don't feel any of this pain anymore? Within 3 weeks, 15 years of pain has gone. Bearing in mind, it's like you got your fibromyalgia, which often related to stress or whatever. How did you feel when you realized that it had gone?
Yeah, it felt incredible. Like my body felt lighter. I felt about 2 inches taller. You know, you just feel like your whole body is so much more open because that's what I'll explain a little bit about the fascia. The fascia is a really strong
Yeah.
connective tissue that goes throughout your entire body. And when I was training as a physio, we were told it was unimportant packaging and just to ignore it. It, they
Yeah.
now they now believe that fascia is the life force of every cell in your body. That Like I was taught that it just wrapped around the muscles, but it actually goes down to the cellular level. It surrounds every cell in your body. So it's like a spider's web, but it's layer upon layer upon layer through your body, through your organs, right into the bones. So, and it's continuous throughout the entire body. So if it gets tight or restricted in one area, which happens through trauma, which can be either emotional or physical, the
Yeah.
fascia starts to solidify. And as it solidifies, it's incredibly strong. So it creates a huge compressive force through your joints, through your pain sensitive structures, your organs. So it really wreaks havoc in your body. And the technique is about applying very gentle, sustained stretches through where the
Yeah.
restrictions are in the body. And that releases the fascia through the entire body. So someone might be working, say, on my pelvis, and I might start to feel my leg wants to move or twitch. That's just the fascia unwinding. It's like getting a better release elsewhere in the body. So no matter where my hands are on the patient's body, I'm treating the whole body
Yeah.
because it's continuous.
Is that when sometimes, your leg might just jolt and do something on his own? Is that related to it?
Yeah, it can be. Like John Barnes would say that your body's doing that at almost a subconscious level all the time. And when people unwind during treatment, that's that he points out that that is probably happening while you're sleeping or, but
Yeah.
yeah, it's just about trusting your body and allowing it. It's a very different treatment because in the past, when a patient came to me, they would just lie on the treatment table and expect me to fix them.
Yeah.
But this is it's more like a joint effort between the patient and the therapist because the patient isn't just lying there and switching off. What you're trying to do with your hands and verbal cues is you guide them out of their head and into their body. So many people live life from here up and they totally ignore their bodies and they don't even know what it feels like to be in their body.
Yeah. Yeah.
And trauma can do that. Trauma can force people to almost leave their body.
Yeah, it's too painful for them. It's the
Yeah,
main area I work in is trauma.
right.
I'm very familiar with that, and obviously when people suffer from trauma, the brain blocks out the pain there, but obviously the trauma is still floating around the body there as well. How do you describe it to like a client that is kind of expecting a massage? What do you say to them?
Well, I explain the whole fascia thing, first of
Yeah.
all. And then I say to them, when we get on the table here, I want you to really leave all your thoughts and thinking behind and come out of your head and into your body. I sometimes get them to do like a little body scan from their jaw right down to their toes. And they want to feel their body melting on the table, like butter melting on a plate, because we all hold tension and we all have our own unique bracing pattern in our body, but we're not aware of it. Like I wasn't aware of it. And I'd been
Yeah.
working as a physio for 20 years
Yeah.
before I came across this. And I thought I understood the body. But when I did the training, I became so aware of where I was bracing in my body. And with awareness comes choice. So as soon as you're aware of where you're bracing in your body, you have the choice to let it go or to keep bracing. So in the treatment, I get them to do a little scan just to get them into their body and to get it to soften and relax. And then wherever my hands are on their body, I'll say, bring all your awareness to the space beneath my hands. So it's like you're feeling your body from the inside out, because we never do that. We never take the time to really go on like an investigative journey deep inside your own body.
No, no, we never do. We're too busy. We got to get
Yeah.
on. We've got things to do. And the mistake people make, they got physical pain, they're aching, they feel terrible. They soldier on, the worst thing that they can do. So to take the time to invest in that, would you say it's a bit like mindfulness, the way they need to get their sort of heads at to kind of be at one? And what would you say?
I think it's slightly different because
Sure.
you're just trying to let go of the thoughts and the thinking.
How do you get them to do that? Because a lot of people are like, right, how do I do this? And probably don't know how to do it. They're too busy stuck in their thoughts and thinking about everything. How do you get them
Yeah.
to
I think
relax?
I keep bringing them back to where my hands are on their body. I'll say, feel the space between my hands or feel the space beneath my hands. Stay there.
So they got a point of focus on them, so you
Yes.
can keep bringing them back,
Yes.
focusing, and over time, their brain It's
Yeah.
just starting to focus on there as
And I
well.
encourage them to close their eyes if they're comfortable, because obviously you can feel a lot more when your eyes are closed. Like when I'm treating, I close my eyes and I'll say to them, I don't talk a lot during treatment because I'm really concentrating on what I'm feeling beneath my hands, because the fascia is a three-dimensional web, so it doesn't ever release just in one direction. It's like a three-dimensional release. So my hands might go in like different directions, different angles. So and you never force the fascia to release. So I'm just going with where their body is letting me go. Mm.
Right. So obviously I don't know this. So how do you know where to go?
Well, the way I start is that I get them to lie on the treatment table and I look at the alignment. I look at their leg length. I look at their pelvis, the bony landmarks on the pelvis to see if there's a torsion or a twist. The pelvis is where all the planes of fascia sort of meet from the top and the bottom.
Right.
And 9 out of 10 times it's out of alignment.
Yeah.
So that's usually where I start. But sometimes it's quite an intuitive treatment. So sometimes if I'm treating one area, either the patient might say to me, "Oh my goodness, I can feel that in my shoulder." When I'm on their pelvis, they might
Yeah.
feel something in their
Yeah.
shoulder or their neck. So that's where I go next. Or
Right.
sometimes if I'm treating one area and I see another area twitching or wanting to do something, then I go
Yeah.
there.
And so what's the reason to go? Because it sounds an obvious reason, but why would you do that? So it's like I could feel it in my shoulder and you're working by the pelvis. So why would you then go to that part then? Is that the part saying it's ready to be dealt with or?
Or that there's an adhesion there or there's a
Yeah.
restriction there. Because if you imagine a spider's web, if you stick your finger in the spider's web and move your finger, it doesn't move the web just where your finger is, it moves the whole entire web.
Yes.
So, like, for example, when I went on the training, there was a girl doing a release in my stomach. There's a psoas muscle, which is a very deep muscle. It sits at the front of your back and it causes a huge amount of back pain. And physios traditionally treat from the back, but they're not getting at the cause, which is the
Yeah.
psoas muscle, which is sitting at the front. So you have to go through the abdomen. So there was a girl doing a release on my psoas in my stomach. And as I was lying on the treatment table, I felt like this incredible pressure building in my jaw and in my teeth. Like it literally felt like someone was pulling my teeth. The pressure was building and building and building. And I'm not one for speaking up in a big room full of 100 people, but I thought, I have to know why that was happening. So
Yeah.
when John was about to start teaching the next technique, he asked, was there any questions? And I put my hand up and I said, how come I could feel that in my teeth? And he said to me, have you ever had any dental surgery or oral surgery? And I had, in my final year at university, I had all four wisdom teeth out. And I
Yeah.
also had a tumor in the roof of my mouth, which was quite extensive. They had to remove it and take a skin flap to replace the hole. It
Right.
was quite a gruesome surgery. I and so I explained that to him, and he said, "Julie, it's tissue memory. Basically, the tissues in your mouth were remembering the trauma of the surgery." Yeah,
Tissue memory.
yeah. So there is a thing called tissue memory where you'll hear a lot of stories about heart transplants. There's a very famous story of, I can't remember the exact ages and details, but there was two children. One child was died a and his heart was transplanted into the recipient child. And the recipient child started having really vivid nightmares of being stabbed to death. And that was how the donor died. But they didn't know, the family or the child did not know that. And his evidence was used in court to convict the murderer that murdered the donor child.
That sounds like it should be a movie or
Yeah,
something.
yeah, and funny, I was speaking to someone recently about this, and they said their cousin had had a kidney transplant, and their aunt said jokingly, "I swear he's had a personality transplant." That the mother had noticed just a real shift
Yeah.
in his personality. And I read a statistic recently that I think it's something like 95% of heart recipient people who receive a heart transplant, 5% of them develop a personality trait of the donor.
I mean, I know you got muscle memory,
Yeah,
but the
it
way that
goes much
you
further.
The
Yeah.
way the human body is. It's like
Yeah.
you got the twins thing. They can be
Yeah.
thousands of miles apart and do the same thing. And with like, I mean, I come from like, I've got over 1,000 half brothers and sisters. So when I got to meet up with a lot of them, it's amazing how similar a lot of us looked. And like one of my brothers, Michael, we've got so many similarities in
Hmm.
same interests as well. Even like comedy series and, like Only Fools and Horses and Minder and all same sort of thing. I mean,
Yeah.
and just sort of our views of things are the same,
Hmm.
and it's not like, well, but yeah, but that could be lots of people, but they're just almost like for like, which is kind of quite funny there as well. So yeah, there's definitely a lot there. It's really, really fascinating then.
Yeah.
When somebody's had the treatment and they're getting off the table, how are they likely to be feeling? To feel like a weight's lifted? Do they feeling like refreshed? Because obviously it's different from your normal standard type of massages where you've got like a knot or something.
Yeah. It depends what they come to me with. If they come specifically with back pain or a knee osteoarthritis or hip arthritis, just different conditions that they come with. If it's a specific issue like that, they generally do feel more freedom of movement, and a reduction in pain. But I more and more I am dealing with people with chronic pain that have tried everything, been everywhere. Like I'm based in a small town in Northern Ireland, but I have people that travel from England, from the south of Ireland, who would come for like an intensive because yeah, I'm the only MFR therapist in Ireland
Yeah.
trained by John. There's one other girl, Rosina. She's done a few of his courses as well. So, but yeah, there is a big demand for it. And I do find more and more that it's people with chronic pain that come to me. So that's why my attention has shifted as well in that I feel like the myofascial release really brought the mind and body together for me. And then I came across the understanding of the three principles through my husband, who is a coach.
Yeah. Tell me those. Tell me the three principles.
Yeah, well, they basically are mind, consciousness, and thought. But what it points to is that our experience is created from the inside out. We always tend to think that a stressful situation or a person causes us to feel stress, but the way the mind works, it's actually not true. All our experience is created from the inside out through our thoughts and our thinking.
Yeah.
Say two people are in a queue at the supermarket and the cashier is really slow and she's chatting away to the person in front. Both people in the queue are in exactly the same situation, but they might experience it very differently. One might get really irritated and the other person might be quite relieved that they're having a few minutes to slow down on a busy day.
Yeah.
So, and it's like road
That-
rage as well. Like people are in the same queue, but one person might lose the plot
yeah.
and
So
another.
it's how you interpret it. It's how your body reacts, and then that can come from previous past experiences, that kind of thing. But with the queue, definitely you see it where you got the checkout person that's chatting away, and somebody in front of or behind them is just going, "Oh, I wish they would hurry up." And I've been there where suddenly I'm sending emails and I need to send an email there as well. And they can take as long as they like. I don't care.
Yeah.
But the person in
Yeah.
front of me is getting really frustrated. They just want to get out of there as well.
So
I don't make
the
sense.
only variable in that situation is what's going on in your head.
Yeah,
So it's your thoughts. It's thought creates feelings, and that leads to behavior.
definitely. Yes. Yeah. So it's about how you manage those feelings and how you deal with that.
Yeah, and it's recognizing that it is a thought, and a thought is neutral until we add meaning to it.
Yeah. I say to a lot of my clients, especially ones that are new to therapy, they often act on feelings and on emotions. And I always say that feelings are not facts. Yeah, I always say that all the time, like a broken record there, because I think it's really important. And then one of the things that I do is I get my clients to recognize the feeling and then question it. Why do I need to act on it? Is it going to benefit me? That kind of thing. A lot of the times we just assume because we feel something that we need to act on it. And the amount of thoughts and feelings we have in a day that are totally wrong, irrelevant. That I get
Yeah.
totally.
So since I've came across the three principles, my husband tried to talk to me about it and it just went over my head. I thought, what are you talking about? And then I suddenly started to see that so many of my chronic pain patients have innocently got caught up in a cycle of fearful thinking and anxious thinking about their symptoms and pain, which I've done myself. Like I tore a disc in my back about 4 or 5 years ago now, and I was in agony. And it went on for 18 weeks. And I knew in my mind that the disc would have healed itself by that stage. Looking back now, I can see how much I was catastrophizing, how much I was
Yeah.
attached to fixing myself, because I'm known as a back specialist here in Northern Ireland. And if I can't fix my own back, how can I fix my patients? So I was overtreating myself. I was totally caught up in the fear of possibly needing surgery, even though I tell my patients to avoid surgery like the plague. So that perpetuated my pain beyond the time that the structural issue had healed itself. So those neural pathways in my brain were being triggered by the fearful thinking,
Yeah.
not by a structural issue. And so that was when the penny really dropped for me, that our thoughts and our thinking can be perpetuating our pain. So that has led me on a journey of the last 2 years researching the latest pain neuroscience and bringing the latest pain neuroscience together with the three principles and writing a book that
Yeah.
is for people with chronic pain.
Tell me about your book that you've written. So I know you've wrote a couple of books, haven't you?
Yeah, the first book, Finding Mystery Within, was my healing journey through discovering myofascial release. So it's really my story.
Yeah.
And then my latest book that's just out a few months is called Quiet Mind, Quiet Body. It's about unlocking the mystery of the mind, finding freedom from chronic pain. So that's a, and yeah, like when I look back to school and my English teacher,
Yeah. Oh,
you
yeah. The
know, I
satisfaction.
never ever imagined I would write a book. Never
Yeah,
going
and
to.
yeah, and yeah, I mean, it's you do it for yourself, and you don't care about anyone else. But there is, for me personally as well, with certain things that you look back and you do get that quite a bit of satisfaction. It's easy to dismiss somebody, especially back in the day, but
Mhm.
to achieve what you've done there as well. And I was just thinking, with your second book, I mean, how much research did you have to do for that?
I read quite a few research articles and listened to a lot of podcasts. I listened to like the top sort of pain neuroscientists in America and Australia. There's a Dr. Lorimer Mosley is in Australia, and he does a fantastic TED talk called Why Things Hurt. It's a 10-minute TED talk and it's brilliant. And then I listened to a podcast with Dr. Howard Schubiner,
Yes, yeah.
and just got some statistics and some pointers. And I started to really see how they're pointing to exactly the same thing that the three principles is saying.
Yeah, this is what I've found with a lot of people that I've spoken to, where it's like, I don't know, like you get somebody on there that's like a motivational coach or whatever, even like somebody that's into spirituality as well. They might have a different spin on it, but it always lands in the same set of principles, whichever way you dress it up there as
Yeah.
well. So, in that sense, it's like seeing like a film, but it's like, pretty much the same storyline, but it's slightly. But
Yeah.
it does give you confidence that, give or take, if you do these set of things, you're going to get this set of results. Not like here, there, and everywhere as well. So that's good. And tell me about like your book then. So it's been out like a few months now. Then
It
what's
came
got?
out in July.
Yeah,
And yeah, it's the feedback is really positive. I'm encouraging some of my patients to read it, and the penny is really dropping for them. How they've innocently got caught up in
yeah,
their thoughts and their thinking. And we all do it. We all have blind spots where we are convinced, that it's something outside of us that is causing us stress, even a diagnosis. But it's really down to our thoughts and our thinking about it.
yeah. For me as a therapist, I say the same things all the time, that it's habits in therapy, and belief systems, and you
Mm-hmm.
can have good ones, you can have bad ones, and they can affect absolutely everything. You get like the quote that, those who say that they are going to succeed and those who say they're going to fail are usually both right. Things like
Yeah.
that. So it is so true. So it's great that you highlight that. What sort of age range tends to be your clients that you get?
I'd say the vast majority would be 40 plus.
Yeah. Why is that? Is it because I don't know, they've had that many years to have that level of stress, or because they realize that they need something different, or I don't know. What would be the reason for that?
I think a lot of people maybe get like little whispers from their body when they're younger, but they ignore it.
Yeah, you can get away
So,
with
so it just gets louder and louder and louder.
it.
And the
Yeah.
symptoms change, and they the symptoms move from one area to another area, and people just do get to that point where they're fed up chasing it, and
I think that as you get older, you become more mindful about your body, about looking after it in this day and age.
yeah.
There, trying to understand things there, so you're more inclined to get people that've done their research and discover. Yeah. So you're the only person in Ireland that actually pretty much does this. Then, so does that mean
Yeah.
that you're like the celebrity for this type of thing?
Well, it's just word of mouth. Like I don't really I'm working my own, from home. I ended up selling my physiotherapy practice
Yeah.
after I trained as a myofascial release therapist. I got to the point where I realized I wanted to listen to my body more and to practice what I was preaching to my patients. And also, at the time, I was working in a physiotherapy clinic with a coffee shop next door. The walls were thin. There was other treatment rooms. And I thought, if someone wants to have an emotional release or feels that there's something, they're not going to go there with those paper thin walls. So I decided to sell my physiotherapy clinic and build a beautiful garden room from home. And I absolutely love working here because I worked in a room with no daylight for 15 years. And now I'm looking out at bird feeders and squirrels.
So even with clients come along, they're going to be in an environment, because I always say, you're a product of the environment you're in. So they're going
Yeah.
to be relaxed even before they've even
Yes, I
started
love
there
it.
as well. So how many years have you actually been doing this now?
I've been doing myofascial release for about 10 years.
For
But
about 10
at the
years.
start, I introduced it very gently
Yeah.
because people were used to me doing a certain thing. I actually it's an Australian method where I use my feet on people's backs to mobilize the vertebrae. And it is brilliant. It's a fantastic method called the Sarah Key method. And I still use it if there's a real stiff spinal segment that's just not freeing up. But I felt that it wasn't addressing the soft tissue and the fascia. So I love the combination of both, actually. But yes, a lot of my patients were used to that force, that a specific technique. So when you're doing myofascial release at the start, when you place your hands on the patient, it's so gentle and you're just letting your hands sink into the depth barrier. You're not pushing. So you sink in gently and then you start to feel into the resistance. And I was worried about how my patients would perceive it or receive it. And I, you know, so I did I did the Sarah Key method, and then I would say to my patients, "So I've trained in this new method in America. I'm just going to add a little bit of it in at the end." And I would do maybe one or two releases through their back or whatever, and then they would come in the next week and they would say, "Julie, whatever you did, do more of that." Because they could feel the difference in their whole body.
Yeah. And with that type of like massage that you're doing, I'm guessing it's a lot less intense than somebody that's doing a sports massage.
Yeah. Although you have to hold each release for a minimum of 4 to 5 minutes, sometimes 10 minutes.
Yeah.
Because you can't, they've done research into it. And if you hold the release for less than 4 minutes, it's just like taking an elastic band. And as soon as you let go, it just bounces back to where it was.
Right.
To actually create a lasting rehydration of the fascial fibers and a softening of that whole ground substance, it has to be held for longer. And if the fascia keeps releasing in that three-dimensional web, you just keep going with it. So it could last for 10 minutes. And then you go into the next release. So the treatments are quite physical, but they're definitely more gentle than what I was used to doing. So
When do you know you've held it long enough? How can you tell?
when it stops releasing.
And it
Just
stops
your
releasing, so you
hips.
know.
Yeah. Yeah.
Yeah. It sounds amazing that nobody else is doing this.
Yeah. There are lots of physios out there that say they do myofascial release, but they use like tools and they leave you bruised. It's not a true myofascial release. I'm a bit of a snob when it comes to a true myofascial release because I just know I trust John's teaching because he's been teaching it for over 50 years.
If somebody's teaching something for over 50 years, I'm probably going to listen to it and do what they do and probably not question it too much, you know? And for yourself, what's the future looking like? Because it looks like that you're in full flow and there's so much that you want to do. So what's next for you?
Yeah, so I've recently changed the way I'm working because I was just doing myofascial release. And then I obviously came across the three principles. And I've realized that no matter how much hands on treatment I do, if someone is still caught up in a lot of anxious thinking, they're just bringing their body back to where it
Yeah.
was. So I really feel that there's a lot more potential in a treatment session if I combine a body mind coaching with the hands-on treatment. So I've now shifted to do that. So my sessions are now an hour and a half long, and it'll be
Right.
half coaching and half hands-on. And my patients are loving actually the combination now of the two. They're really feeling a shift.
Yeah, that's
It's the way my work is changing. And then I've also had the opportunity to do a retreat in Spain around quiet mind, quiet body. I'm doing a day in London on the 13th of December, like a workshop with another friend. I'm doing one in Phoenix in Arizona in January. So yeah, there's another retreat in England May next year with a lovely friend as well, who's a 3P coach. So yeah, I love that sort of thing. I love working with small groups and really taking them to a much deeper place with the whole mind body connection.
That sounds great, and the fact that you're doing places like in Arizona, you know, retreats, things like that, it just sounds
Yeah.
like you're growing and growing, and you're so busy. It's just brilliant. I think it's really fascinating. I love the conversation today. It's so interesting to hear about a subject you don't know a lot
Mhm.
about, because I kind of think that if I don't know it, there's probably going to have people out there that might not know it as well. But it's really interesting with what you're saying, and you make it sound like so simple there as well, and you can see the benefits that you get from it. It just amazes me that more people are not doing what you're doing, because the difference that you can make is just amazing there as well. But yeah, I think it's great. Thanks ever so much for coming on the podcast there, Julie. It's been such an interesting conversation. I've loved every second of it, and I wish you the best with all what you're doing there, because it's just such a brilliant thing that you're doing, and the amount of benefit you're giving to a person, which is different to the norm, is brilliant, and they're getting so much from it. So thank you so much for coming on, Julie.
No worries. Thank you so much for the opportunity. I really enjoyed it too, Lee. Thanks.
Thank you.